Nurses at the Bimbila Hospital in the Namumba North municipality have initiated a sit-down strike due to the prolonged absence of water in the hospital for the past 2 months. The issue arose after the community water company in Bimbila disconnected supply to the hospital due to non-payment of bills. Now, as per the water company's records, the hospital owes over 240,000 Ghana cedis. Regrettably, this has led to patients being turned away, as the nurses firmly assert that they will not resume work until the water supply is restored. There is more in this report, followed by our regional correspondent, Mohammed Aminu Alabira.
The Bimbila Hospital has in recent times been in the news over the hospital's inability to pay its water bills, a situation that impacted negatively on its ability to facilitate effective healthcare delivery. The community water system operating in the area has on a number of occasions disconnected the facility, but on all such situations there is intervention by stakeholders in the area, which eventually leads to reconnection. This time round, it appears things have gotten out of hands, as the management of the water system insists that until significant amount of the bills owed is paid, they are not ready to reconnect water to the facility. According to the manager, the hospital owes over 240,000 Ghana cedis, and that after several negotiations, management of the hospital has reneged on its promise to honor its obligations. Following the development, nurses at the Bimbila Hospital have initiated a sit-down strike over the lack of water. In an interview with Citi News, the medical superintendent of the hospital, Dr. Barhama Adam, expressed concern about the situation.
As we speak now, there is no water supply to the hospital, and this has been so for the past 6 months.
Wow.
Yeah, the Water and Sanitation Agency came and disconnected water supply to the hospital for the past 6 months. So the hospital has been without water supply. And this is really, really most unfortunate. I mean, this thing shouldn't be happening in this 21st century. Okay?
As to whose responsibility it is for the payment of their bills, the medical superintendent said it is the central government who is responsible. He says a number of letters have been written to the ministry for payment. He showed Citi News a letter written by the Minister for Health on the 11th of July 2023 for the payment. The letter, whilst acknowledging the responsibility of central government to pay, however, asked the facility to initiate measures going forward to pay their own bills. On the nurses' sit-down strike, the medical superintendent says it is a worry to the hospital administration.
We try to engage them, just to let them know how far we have gone with this. And they said, well, they have, they appreciated the effort we made, but they think that, it is not right for this development to continue.
Manager of the water system, Ibrahim Sugri Issa, insists they will only reconnect water to the facility if outstanding bills are settled.
So as we speak, I don't know when we are going to connect them. During the meeting, they couldn't tell us whether they are going to pay the bill or someone is going to pay, and then who. They couldn't tell us. So we wrote to them that we cannot give water to them when they don't even know who's going to be responsible for payment of the bill.
For now, the nurses are on a sit-down strike, and any patient to the facility is either referred to Yendi or turned away. For leaders and stakeholders in the area, there is the need for urgent government intervention to prevent an unfortunate happening.
It has been disconnected
from water for the past 6 months, I am told. And patients and doctors here struggle for water. As you can see inside, many of the walls are without water, and the pipes here are dried. For Citi News, Mohammed Aminu M. Alabira, reporting from the Bimbila Government Hospital.